Hi, I'm Regina Hood,
I'm Kelsey Hannan.
I'm Kyra Brown.
and we're going to present our assessment portfolio. We decided to divide our assessments by interview, participation, ADLs and IADLs,
Client factors, motor performance.
Cognition and home safety.
We're going to begin with our interview assessments. We had the Canadian Occupational Performance Model, OPH2, and OCARES. However, we're going to be focusing on the COPM because that's what we focused on in class. The purpose of this assessment is to identify issues of personal importance to the client and to detect changes in the client's self-perception of occupational performance over time. So we're typically going to be working with a population for clients who have occupational performance problems and disabilities. Our areas of assessment will be self-care, productivity, and leisure. This is a non-standardized assessment with good reliability and validity. It's going to take around 20 to 40 minutes to complete, and all you need is the score sheet. Next, we have our participation assessments. We decided to focus on the activity card sort and the role or interest checklist for participation. The purpose of the activity card sort is to elicit levels of participation in IADLs, high and low demand leisure activities, and social activities, and whether recent changes in health or age have affected participation. The population involved will be older and middle-aged adults. However, you should not use this for clients with impaired sight. As stated before, our areas of assessment are IADLs, low and high demand leisure activities, and social activities. This is a standardized assessment with good reliability and validity. It takes around 20 minutes to complete, and you need the 89 cards for your material. The purpose of the role and interest checklist is to assess the client's roles and intentions and motivation to perform the task of their role, as well as their perception of changes in roles associated with health status. The population for the role and interest checklist is older adolescents, adults, and the elderly. This is a non-standardized assessment with a good test-retest reliability and construct, content, and concurrent validity. It's going to take around 15 minutes to conduct, and all you need is the checklist. Next, we have our ADL and IADL assessments. We have our Coleman Evaluation of Living Skills. Its purpose is to indicate a client's capacity for living independently. We're going to primarily use this assessment for short-term psychiatric adolescents and adult inpatients and cognitively impaired adults. This should not be used for clients whose living situation changes frequently. We'll be assessing self-care, safety and health, money management, and employment and leisure in this assessment. This assessment is not norm or criterion referenced. It has good inter-rater reliability and concurrent validity. It takes 30 to 45 minutes to conduct, and for this assessment you'll need pen, paper, pictures, a telephone book, an electronic device, change in cash, and bills. We also decided to focus on the EFPT. The purpose of the EFPT is to determine which executive functions are impaired, determine the individual's capacity for independent functioning, and finally to determine the amount of assistance necessary for task completion. Our population is going to be adults with cognitive deficits. However, you should not use this with patients who have low or no vision. The areas of assessment for the EFPT are simple cooking, telephone use, medication management, and bill payment. This is a standardized assessment with a good inter-rater reliability and internal consistency. It also has construct and concurrent validity. It's going to take 30 minutes to conduct, and the materials you will need are oatmeal supplies, phone books, medicine, a medicine bottle with candy, and money or bills. The last IADL and ADL assessment we decided to focus on was the PASS. The purpose of the PASS was to provide a baseline status and measurement change of following intervention or age association or disease-related change. The population is going to be adults with a very wide variety of diagnoses. However, you should not use it for adults with cognitive impairment. This will be assessing ADLs and IADLs, and this is one of our only criterion-based assessments. It has good inter-observer reliability and test-retest reliability. It also has content validity. This test is going to take longer to conduct at about 1.5 to 3 hours. and you'll just need the individual forms for each task to conduct this. Now we're going to look over our client factor assessments. The client factor we decided to focus on was the Sens-Weinstein monofilaments. This assessment assesses the cutaneous sensation levels of the patient. The population is going to be children or adults, however, you should not use it for individuals with open wounds. We can assess the hands or the feet with this assessment. This is a norm-referenced assessment, and the different monofilament sizes will indicate how the patient is functioning. So if the patient has 2.83, they'll be within normal limits. 3.61 indicates diminished light touch. 4.31 indicates diminished protective sensation. 4.56 indicates loss of protective sensation. And 6.65 indicates only deep pressure sensation. This test has an iterator reliability of 0.96, and it has construct validity. It'll take 10 to 20 minutes to conduct, and you just need the monofilaments and a pictorial form to record your results.
Next, we'll be going over motor performance assessments. For the first motor performance assessment, we're going to look at the dynamometer and pinch meter. The purpose of this assessment is to measure isometric muscular strength of the hand and forearm. Population typically used is pretty broad, including CVA, Parkinson's, and nerve impairment. You will be testing grip strength and pinch strength. The three different types are tip-to-tip, palmar, and key. It is a norm-referenced assessment and has good excellent inter-rater test-retest reliability and excellent validity. The materials used are the dynamometer and pinch gauge and takes about 10 minutes to administer. Next, we will be looking at the box and block assessment. The purpose of this assessment is to assess manual dexterity, typically used with adults aged from 20 to over 75 years old, with and without disabilities. So the areas of assessment are going to be coordination, dexterity, upper extremity function. The scoring is norm reference, and the reliability includes test-retest reliability, inter-rater reliability, and we do have concurrent validity. The materials used are box with blocks and takes about 10 to 15 minutes to administer. The next assessment we're going to look at is going to be the Bennett hand tool test. This test is going to be used in order to assess an individual's skill in using ordinary mechanical tools. So typically this is going to be used with adults who need an evaluation for a job demand analysis. The areas of assessment are going to include manipulative skills as well as medium dexterity. So it will be a norm reference score, and the test-retest reliability is good and also has criterion validity with hand testing. The materials used will be the hand tool, bolts, wrenches, and screws. There is no time limit to administer this test. Next is the 9-hole peg test, and the purpose of this assessment is to assess fine motor coordination by placing 9 pegs into a pegboard. So this can be used on individuals aged 4 to 94. We're going to look at fine motor movement, hand dexterity, finger joint stability as well. So the scoring will be norm referenced, and the reliability does include good inter-rater reliability as well as test-retest reliability. There is also concurrent validity with Purdue pegboard in both the right and left hand. And the materials used will be the pegs and pegboard. Typically this test takes about 10 minutes to administer for both hands. Next is the groove pegboard, and with this one you're going to assess eye-hand coordination and dexterity used with children age 5 all the way up to adults. So you will be looking at eye-hand coordination as well as dexterity. This assessment is standardized as well as norm referenced. So it has test-retest reliability on both the right and left hand and concurrent validity as well. The materials used will be the grooved pegs as well as the pegboard, and takes about 10 to 15 minutes to administer. Our remaining motor performance assessment that we'll be looking at is the Jepson-Taylor hand function test. And this test is going to assess the effective use of the hands in functional tasks. So we'll be looking also at children and adults over 5 years old. The areas of assessment, it does have 7 subtests, and it's going to include writing, card turning, picking up small objects, simulated feeding, stacking checkers, picking up light objects, and picking up heavy objects. So the scoring, it is a standardized assessment, and it will be norm referenced. This test also has test-retest reliability ranging from 0.6 to 0.99, and the validity does include content validity as well as construct validity when compared to the Klein-Bell ADL scale. Materials used are the board as well as all the documents and materials necessary for the subtests, and the time to administer is about 15 to 20 minutes for both hands.
Okay. Now on to the cognitive assessments. Okay, first one is the Toglia Category Assessment, or TCA. The purpose is to examine ability of adults with brain injury or psychiatric illness to establish categories and switch conceptual sets. The population is for adults 18 and older who have neurovascular impairment or schizophrenia. Areas measured include deductive reasoning, categorization, and awareness. The scoring is based on number of cues required. The reliability is inter-rater, it's excellent, and for validity, concurrent correlation is with a p-value of less than 0.001. The materials include 18 plastic utensils, and the time is 10 to 20 minutes. Now on to the LOTCA, which stands for Lowenstein OT Cognitive Assessment. The purpose is to evaluate the basic cognitive abilities in cognitively impaired clients. The population is for those with brain injury, spinal cord injury, degenerative and psychiatric diseases, as well as underachieving students. Areas measured include orientation, visual perception, psychomotor abilities, spatial perception, motor praxis, visual motor organization, and thinking operations. So with scoring, it's on a scale from 1 being low to a 4. Reliability is excellent for inter-rater, and validity correlates highly with the LOTCA. Materials include card decks, colored blocks, pegs, and a pegboard, scissors, and a scoring sheet. Time to administer is 45 minutes. And on to the MOCA. The purpose of the MOCA is to assess attention, concentration, executive function, memory, language, visuospatial skills, conceptual thinking, calculations, and orientation. Population is for adults with mild cognitive dysfunction. Areas measured include attention, concentration, executive function, memory, language, visuospatial skills. Oh, I already said that. Scoring. Scores of 26 and above are within normal range, and it is norm referenced. Materials include a 1-page handout, and the time to administer is 10 minutes. For home safety, we have the SAFER, which stands for Safety Assessment, and Function and Environment for Rehab. The purpose is to assess a person's safety in their home environment and the population of adults in their home environment. Areas measured are living stimulation, mobility hazards, scheduling, scoring. Each task is rated as 0 with no problem to severe, which is a severe problem. Time to administer, 45 minutes.
And that concludes our presentation. Thank you for watching.
Bye.